If there were ever an American city in crisis, look no further than the streets of Detroit. With over 77,000 vacant homes, a once booming population of 1.8 million has now dwindled to less than 700,000. In the 1960s, the city had the highest per capita income in the nation, and now this same city finds itself financially unstable with $20 billion in debt. The disappearance of the manufacturing job has had the greatest impact on the economy. In less than 65 years, manufacturing work has plummeted from 300,000 jobs to less than 30,000 jobs. Half of Detroit's population is illiterate and unemployed, and 60% of its children live in poverty. Detroit has one of the highest crime rates in the United States and has a murder rate 11 times higher than New York City. This is happening in America. This is an American city, and it is the poor who are paying the ultimate price for this crisis. The objective of this project was to study and see firsthand how poverty is manifested in Detroit across 5 cultural subsystems of healthcare, financial support systems, housing resources and homelessness, early childhood education, and K-12 education. The guiding questions used for this study included: what are the overarching themes that change agents in the city employ? What are the keys to turning around an American city in crisis? How are social subsystems manifested and how do they work together? Does the city have a master plan to ensure that all subsystems are being considered? Most importantly, what is the future for the children who walk these streets? Will their future be different as members of the Detroit new community? This Detroit experience was an in-depth study of the challenge of change in a large American city. From June 4th to June 14th of 2014, I engaged in a study of the city of Detroit and completed 22 interviews and visited 28 locations within the city. After data collection and analysis, there are 2 main themes that emerged in this research. As the city struggles to reinvent itself, one of the challenges consistently voiced was just the right approach to this reinvention. Gentrification is a word with which I was not vastly familiar prior to this study, but not a day went by that this word was not used from the people in Detroit. The other theme that has come to the forefront of this study is the role of labor and employment, both historically and in the present, in the city of Detroit. The city of Detroit has layers of challenges. It must be addressed in a systematic way. Revitalizing the city can be done in various ways, and how groups are attempting to do this depends on the lens by which they see these challenges. One of the best quotes I heard during my study of Detroit came from Dr. Marcella Wilson, President and CEO of Matrix Human Services, in which she says, "We must treat poverty as a disease that needs treatment and not as a character flaw." If the decision makers in Detroit see these issues through this type of lens, the decision to be made would not include gentrification, and the emphasis would be on job training and employment. There is still much to learn about the city of Detroit, and I have been amazed at the affinity I have for the city. I did not realize how attached I could feel to a community in just this short time. I was inspired by the stories and the work of change agents, and am forever grateful for their trust and willingness to allow me to capture a snapshot of their home.